Phlebectomy is a common technique used to clear varicose veins in modern vein practices. Traditionally, phlebectomy is performed in a vertical fashion where the vein is targeted by inserting a phlebectomy hook through a small incision directly over the vein. While this is useful for larger branch veins, it can be difficult for smaller veins. Horizontal phlebectomy is a novel technique developed by surgeons to address some of the limitations of traditional phlebectomy with the hopes of expanding the number and configuration of veins that can be treated with phlebectomy. The VenX Reach is a single-use sterile product that can be used to apply phlebectomy techniques to clear small subcutaneous veins and reticular veins. With this novel design, a hook is positioned inside of a needle shaft. The needle is advanced under the skin in a horizontal fashion. Once in appropriate position, the handpiece is actuated and the hook is exposed from the needle. The operator is then able to remove or disrupt a section of vein by retracting the device. After standard surgical prepping and draping, a wheel of 1% lidocaine with epinephrine is injected at the treatment site. The subcutaneous fat is then infiltrated with tumescent anesthesia. The VenX Reach is then inserted through the skin. The tip of the needle is advanced under the skin in a vertical fashion, just a millimeter or two on the underside of the dermis to the area of the target vessel. This is performed with the levers not depressed, so the hook is not deployed. Once in appropriate position, the levers are depressed, which causes the hook that resides within the shaft of the needle to be deployed. As the device is retracted, the hook grabs the vein under the skin and disrupts it. This is represented by a small amount of bleeding from the insertion site. The levers are then released and the hook retracts back into the needle. The VenX needle is then withdrawn and advanced to the next target area. Horizontal phlebectomy with the VenX device is a novel approach to treating reticular veins and small subcutaneous veins. This technique utilizes the strengths of phlebectomy on veins typically treated with sclerotherapy while eliminating the complications typically seen with this procedure. This new procedure will allow for a subset of venous disease which is currently difficult to treat to be treated safely and effectively with few complications.